Hi everyone, I'm Dr. Roper with Newcastle Dental. Let's talk about palates or the roof of the mouth today. The palate is the tissue or the structure that sits right behind your front teeth, and that actually is where the tongue should rest at all times as well. So this is an example of a high vaulted palate, and this would be an example of a more normal shaped palate. And what you can see between these two sets of teeth is that this one has more of a V shape to it, and this one has more of a U shape to it. So if we're looking at how the alphabet actually is, this one is more of a V, and this one is more of a U. It just basically means that this one is more constricted this way. If you look at them kind of from the back of the head, you can definitely see that steepness that forms there. And so this one has more of that steep incline, like the vaulted roof of a cathedral, versus this one, which is a bit more broad and flat and spaced out kind of in the width direction there. So the way that forms is actually based on where the tongue sits during the growth and development stage of life. And the reason that is important is because if the tongue is able to sit at the roof of the mouth and widen that arch, it basically widens our airway and allows us to get more oxygen, which leads to a lot of other health issues if we have a lack of oxygen. One of the things that we're seeing in kids that have these constricted palates or airway issues for other reasons is ADHD, allergy problems, restless sleep, bedwetting, problems just issues in school or learning in general, and a host of other problems. So I'll actually link a list to the bottom of this video so that you can check those out, see if your child has any symptoms that you're aware of, and there's also things that you can look at or look into while they're sleeping, so you can actually observe them and see if they're snoring, see if they're grinding their teeth. All of these things, we're having studies to show that they go hand in hand and there's some sort of connection there. So the reason I bring it up is because we are looking at this in kiddos in our office, and we want to kind of take the more preventative role in noticing things earlier on in life so that we can take advantage of their growth and development stages. So, for example, my daughter is 18 months old. I already can see that she has a high palate, and I believe that it may have some genetic component, but also maybe something going on with just the, if her tongue might have a tongue tied towards the back. I haven't had her evaluated for it yet, but I am going to do that soon. But what can happen with the kids, if they're just not placing their tongue in the correct spot, we can work on that with giving them some appliances that called habit correctors that basically train the tongue to sit at the roof of the mouth so that it can help develop things naturally. Or we can also give them some appliances to strengthen the muscles, something to chew on, strengthen the muscles here that are involved in chewing. And when you strengthen the muscles, you strengthen the bones and develop the bones that are attached to those muscles. And then all of the other facial structures like the sinuses develop along with that. As we get into a little bit of older age, like 5 to 7 years old, we can start doing expansion. So we can actually put something in the roof of their mouth and help to widen and grow it out this way so that they have more room for their airway and for their tongue placement. That also helps with the straightening of the teeth. But I think that having the straight teeth is a happy side effect that goes along with this. I think much more important is getting the adequate amounts of oxygen each night as they sleep. Again, having oxygen for your immune system, just for your overall cardiovascular function, it's really, really important. It's the number one thing that we need in life. So we need to make sure that we're doing everything that we can to help that along. So follow us along. I'm going to try to document what I am doing for my daughter along the way, and I'll keep you updated on that, but I'll also keep you updated with what we're doing with other kiddos in general and post some photos. But if you have any questions, feel free to contact me, and we are here if you need us, okay? All right, have a great one. I will be in touch. Thanks so much.